Hello once again, you all. It is Tab Nashville Gospel Radio, WFTB 104.1 FM, Nashville Gospel Radio. Also, Clarksville, you can hear that over the airways. Also being recorded, you all, Sacrificial Conversations tonight. It is an amazing time in the world, you all, to just be living with what's going on in the world, and we are just so excited tonight to be able to give you all another exciting show. You all, God is doing so many amazing things. He is bringing people to the platform, you all, to the radio show that is changing our lives, you all, and giving us some great information. Last week was amazing, but tonight, y'all, we have someone that is extraordinary, because she's done some things that's going to help people think a little bit different about some things that's happening in the medical industry. Okay. And when we have people in the medical industry, I get excited because of the things that I've been through in my life and some of the medications that I'm on. But on tonight, you all, we have Dr. Lametra Scott joining us on tonight. We are so excited to have you in this place on tonight. I've been trying to get this young lady for about a year or so now, because you all, she has a amazing story that I'm gonna let her talk about a little bit tonight. Lametra, introduce yourself to our guests on tonight and just give us a small resume of who you are, some of the great people in your family, and just let us know what's going on tonight, young lady.
Well, my name is Dr. Lametra Scott, and I want to thank both you, Teddy, and Monica, for the invitation to be here and to share with you all just a little bit of something it's big in my life as it relates to sickle cell disease. A lot of people may not be very familiar with sickle cell disease, or even know that it even still exists. But I feel that me sharing the story on how it impacted my life and what brought me here today, as we get further into our conversation, it'll definitely shed a light. And even if you're not directly impacted by sickle cell disease, you'll feel empowered to help become an advocate alongside those that are in the sickle cell community. Prior to me starting Breaking the Sickle Cell Cycle Foundation, my connection to the medical industry is that I am a pharmacist, and I've been doing pharmaceutical work now for over 20 some odd years, and I wouldn't have it any other way. I started out, I would say, an undergrad working at Walgreens Pharmacy, if you can believe it or not. That's where I started. And right now, I am actually the director of pharmacy for the Tennessee Department of Corrections. So my experience is very varied, from, like I said, working at Walgreens on retail pharmacy, and to what I'm doing now on a more executive level. But along the way, my job has always stayed the same. And it's to do disease state management and education, whether I was doing that at the pharmacy window when talking to people that are coming to pick up their various medications and talking to them on the educational level, or to the standpoint of where I'm talking to healthcare providers and helping them to manage complex disease states and how to do that in a cost-effective way. So that's a little bit about my background and why I'm here tonight talking about sickle cell disease.
Absolutely. Monica, you want to start us into this conversation on tonight, young lady?
I will. Good evening, listeners. My husband do his normal spiel today, so good evening to you all. Happy Monday. I hope everyone had a blessed day. But we're going to get started with Dr. Scott, because I'm a little excited. I learned a little bit about, I'm not going to say learned, I knew of a person that had sickle cell when I was small. But, when you are growing up, you hear things, but I was one of them children where my mom said you stay in the child's place. So I didn't really get to learn a lot about the sickle cell disease. I know she had it, and pretty much that's it. So I am just elated to learn what Dr. Scott has to tell us tonight. So my first question is, for listeners who may not understand sickle cell disease, can you explain in simple terms what it is and how it affects the body?
I'll explain it the way that I explain it on a small kids level so that everybody understands. So when we talk about sickle cell disease, first and foremost, we're talking about a condition that impacts your red blood cells. Red blood cells are responsible for carrying oxygen all throughout the body. We need oxygen to breathe. We need oxygen for all functions that are necessary. That is the job of a red blood cell. Well, in sickle cell disease, that person's red blood cells don't function properly. Instead of being round and soft like a donut, in sickle cell disease, that person's red blood cells are actually very hard and they're shaped like a banana, or we call it a crescent moon shape. So drastically, you can see that the shape of a banana and the shape of a circular donut are not the same. So when those cells that are having that banana shape don't function very well, they stick to each other, they stick to the blood vessel wall that's on the inside of your blood vessels, they stick together. And when they do that, they form blockages in blood flow. That blockages in blood flow causes pain. And as we know, you have blood flowing all over your body. So that means you can have pain from the top of your head until your toes. That's just how impactful sickle cell disease is. It's a red blood cell disorder that impacts every organ system in your body, causing extreme pain, causing organ damage, causing increased risk for stroke, increased risk for infection. And in addition to those physical attributes that are associated with sickle cell disease, people oftentimes struggle with the emotional, mental side of sickle cell disease, dealing with depression, anxiety, PTSD. Those are the things that you cannot see associated with sickle cell disease.
Wow. So it's a lot of things associated with this thing. How common is this in the African American community, or is it more prevalent in other nationalities?
It is very common in the African American community, and it disproportionately impacts African Americans, although it can happen in almost any ethnic group. And I say disproportionately affects African Americans because one in about 365 African Americans births per year result in sickle cell disease. But when we talk about sickle cell trait, 1 in 12 African Americans carry the trait that causes sickle cell disease. I'll stop right there because I think that people need to appreciate what that means. I'm pretty sure you know more than 12 people.
Right.
So amongst all of the people that you know, a vast majority of them probably are sickle cell trait carriers and don't even know it. That's because a lot of times people with sickle cell traits, they may not experience all of those pain complications that a person with sickle cell disease has, but they may be able to pass this trait on to their future generations, to future children that they may have. Or sometimes if a person with sickle cell trait participates in activities like extreme sports, or going to a place where the atmospheric pressure may be a little bit altered or different. And they may begin to experience pain then. So at any point in time, those people may be put into a situation where they can experience something that's called exertional sickling, and they may begin to experience those same complications as a person who has sickle cell disease.
I wanna break this down just a little bit though, now. Give some simple, and I really want to like give this an elementary answer. So what are some of the simpler things that we can look for, or someone if they have that and don't know? Is it something that you can detect quickly, or something that you should look for? Because when you say what you just gave us, you don't want to go undetected and be living a life and don't know you even have this. So that's something that I deal with because I'm a diabetic, and I may have went about 5 years or so until I literally went to the doctor and got diagnosed. So I really, is there anything that you can say, because your story that we're about to, because we're going to dive a lot deep into this, but is it any simpler or any traits that you know of that people can look at, or that's been talked about that this people may?
I'll tell you this. Yeah. I'll help you out, Teddy.
Help me out, because
the most simple thing that you can do is get a blood test for sickle cell trait. That's the most simple thing that you can do, because it can only be diagnosed by way of a blood test that is conducted. So any newborn children or any babies that are born today, in today's time, currently, the sickle cell disease testing is a part of the newborn screening. If you were born prior to the time where newborn screening included sickle cell disease, if you were born prior to that time, then you would just need to go to your doctor and ask for a sickle cell trait test. Another way that people can get sickle cell trait testing is donating blood to either the American Red Cross or either Blood Assurance in the Nashville area, because both of those organizations actually test donors who identify as African American. Those samples are actually tested for the presence of sickle cell trait. So those are two real easy ways in which you can get tested. And then as we get further along, if people were to follow our organization, whether it be on Facebook or any of our social media channels, typically at our community events, we offer free sickle cell trait testing. So first and foremost, get sickle cell trait tested to learn what your sickle cell trait status is. Secondly, if you are someone who does not know what your sickle cell trait status is, but you know that it may be in your family, if it's in your family, then it could or could not be impactful to you. So I would say if you're a person who participates in any type of sports activities, pay attention to your body. If you're outside and you're running or you're doing some extreme conditioning and you begin to feel like your muscles, like your leg muscles, they may start to get these extreme cramps, or your legs may feel extremely heavy, like you can hardly pick them up, that may be a sign that you've got something a little bit more serious going on and you need to stop, take a break, rehydrate, reoxygenate. Because what we don't want to happen is for your body to start to experience a condition where those cramps that you may be feeling are the beginning of something that is termed rhabdomyolysis. And that's where your muscle tissues begin to break down because they're not getting the adequate oxygen that they need. And when that muscle tissue begins to break down, the intracellular contents that come about, they can cause you to have cardiac abnormalities, which could be fatal. So I say all that to say, if you have sickle cell traits, or even if you don't know and you think there's somebody in your family that does, and you're participating in any type of physical activities and you start to feel winded, you start to feel like you've got these extreme muscle cramps, most of the times when people are conditioning, the mantra is, pain is weakness leaving the body, or, go hard or go home. Or for people who have sickle cell traits, that could be something that could be very detrimental. And that's a signaling that the body is saying, hey, stop, something is happening. We need to go and see about this.
So Dr. Scott, real quick, does insurance cover this test that you're saying, asking people to go get in order to know if they have sickle cell?
Because everybody's insurance is different, I cannot speak to what's covered and what's not, but it is a diagnostic. And I would say maybe about $100, like even if you just went to a LabCorp or Quest Diagnostic because you wanted to go independently. Mm-hmm. That is something you could do, and the out-of-pocket cost would be roughly around $100 or so. But just based on your regular preventative, it should be covered under preventative services under your insurance, just like you go and get an annual flu shot, mm-hmm. where you typically don't have to pay anything because it's preventative. So that may be something that you could ask your insurance carrier about. And if there is pushback as to why do you need this, well, you're African American. If you identify as being African American or having African American ancestry, something to that effect, that means you are at risk for being a sickle cell trait carrier.
Wow. So let me ask you this. Why do you believe that this disease doesn't receive the same awareness as other diseases, that we know about? So why you think that?
Because it's something that impacts minority populations more than others.
Wow.
And we all know about the racial divide that is in the cloth that builds America. It's the elephant in the room that we know is always there. And anything that I would say impacts minority populations more so than others, typically those are things that are less funded, less researched.
Wow. So you look like you jumped up.
Just because I know you hear about diabetes, you hear about high blood pressure, but sickle cell is one of the ones I know you just said rarely is anyone talked about. It's not talked about, as well as like you say, you all have sickle cell drives. I'm gonna call it that. I have never seen that, and I'm almost 54 years old, so that's kind of odd. So that's why today when he said we was going to talk about sickle cell, and I did my little research. I was like, well, this is just as important as diabetes, high blood, those things as well. But this is like kept under the surface.
Wow.
Right. Because if you deny that something exists, then guess what? You don't have to do anything about it.
Wow.
It's when it's called to the carpet and everybody has eyes on it, now it commands attention. But we have to have more and more advocates that are not directly impacted by sickle cell disease, advocating on behalf of those who are impacted by sickle cell disease. Because when you think about cancer, for example, we have all types of runs, walks, you name it. Everybody that participates in those events are not all cancer survivors.
Correct.
Yes, there are some, but they also have a whole village that understands the messaging. They understand the importance of why we have to advocate on behalf of cancer patients. The sickle cell community deserves that same sort of village to help open up doors and increase research. Because if it's not important to us as a collective, why would it be important to anybody else for them to come and join in with us?
So, I'm finna turn the page right here. What actually made you become a advocate for sickle cell, the disease? Please join us in this conversation and enlighten us on what made you an advocate, because you have to have something to make you want to do this. Come on.
Well, I do. And my why is my son. I have a 13-year-old son who has sickle cell disease. And I was not aware that I was a sickle cell trait carrier. Again, I'm one of those 1 in 12. I didn't have any complications for sickle cell disease. I was born during a time where they didn't have universal screening for sickle cell disease and sickle cell trait. So my parents never knew of my sickle cell trait status. And the same thing for my son's dad. We didn't know that he also was a sickle cell trait carrier. None of this information was news to us. So after, I think I was probably about 16 weeks pregnant, I was going to the doctor, and the doctor came back when they do all the genetic testing, and she says, hey, did you know you were a sickle cell trait carrier? And I was like, a sickle cell what? So for me, the knowledge that I had about sickle cell disease came in undergraduate when I was studying genetics.
Wow.
I remember it from way back when, but that's also pretty much all the information that I had about sickle cell disease. Even though I've been in school for a long, long time, studying all these other medical conditions, sickle cell disease was like a bleep in the history of maybe 12 years of schooling after high school.
Wow.
So again, my son was misdiagnosed initially. I got the information that he only had sickle cell trait. Wait a
minute. So your son was actually misdiagnosed by doctors who literally had blood tests on him as well, or they? Because I want to make sure I get this correctly now. That they had blood work and misdiagnosed your son, is what you're saying?
That is exactly what happened, and I'll have to explain to you how the blood work goes.
Okay.
So when a baby is born, there's something that's called a newborn screen that's done day 1 when the baby is born. That newborn screening test can give you a false negative if it is done too soon as it relates to sickle cell trait. All the other conditions, they most likely have, viable and reliable information at that newborn screening. But if there's a possibility that the baby could have sickle cell disease, you have to do a follow-up screening. That follow-up screening has to occur between 6 to 8 weeks after the baby is born. That is because the way that the body produces hemoglobin. During the infancy period, or the fetal period during gestation, the body makes something that's called hemoglobin F, F meaning fetal. Well, after the baby is born, at about that 6-week time frame, the body turns off a switch for making fetal hemoglobin, and it turns on another switch to start making normal adult hemoglobin. It's called hemoglobin A. That's why you have to wait at least 6 to 8 weeks before you go and get confirmation screening to determine whether or not your child has sickle cell disease. Well, I took my child to go get that confirmation screening. I want to say maybe about 10 or 11 weeks, because I knew if we went too soon, we could get some information that may not be accurate. So we waited a while. And in the interim period, before my son was even born, I started interviewing pediatricians because I knew that there was a possibility that he could have sickle cell disease. So I needed to make sure that the pediatrician that I selected was going to be someone who was able to take care of a baby who had sickle cell disease. So fast forward to the 10-week period. I take my child to go get screening. They get all the blood tests done, and I'll never forget this. My son was born in September. The doctor called me the day before Thanksgiving. She says, "Oh, I have great news, Ms. Scott. Your son doesn't have sickle cell disease. He only has sickle cell trait, just like you and your husband, so he's fine." And I was like, "Oh, thank you, Jesus. My baby is fine." So at this point, I started calling my mom, like, "Mom, why didn't you tell me I had sickle cell trait?" And my mom didn't know, because at that time, I hadn't told anybody that it was a possibility, because we didn't even know. His father and I didn't even know that he could have trait. So after we got the information that he only had trait, I thought everything was good. Well, thankfully, that newborn screening that is done on the first day that the baby is born actually came back that my son actually was producing hemoglobin S, which is sickle hemoglobin. He was producing that actually on day one. So I got a call from someone from the health department. And the crazy thing is, I had actually been getting letters in the mail, and eventually I actually answered the phone when the health department called. And they said, "We've been trying to get in contact with you because we need you to bring your son in for confirmation screening." And I was kind of like, "Why do you need to do that? I've already taken my son to our pediatrician. We got the test done. They said he only has trait. He's fine." And the lady at the health department, she said, "No, ma'am, he's not fine. Your son actually has sickle cell disease type SS, which is one of the most common forms of sickle cell disease, and also one of the most painful forms of sickle cell disease. And we need to get you started. We'll get him started on prophylactic antibiotics. He needs to get connected with a hematologist, the whole 9 yards." So you can only imagine, at that point in my life, it felt like somebody had snatched the rug from underneath me. And we're going to talk about being mad at God, because I was so mad. But I tell people all the time, even with any medical condition or diagnosis that you're faced with, whatever it is that you're feeling, you need to process each and every one of those feelings. The silver lining is not staying in those feelings. What can you do to move forward, move beyond where you are? And that's where I found myself. After God and I had to talk about this for a long time, and I had to come back to what I know to be true. This may have caught God by surprise, but it didn't catch, it might have caught me by surprise, but it didn't catch God by surprise. Yes, so clearly, he has a purpose in this happening in my life. So I just had to take a minute and sit down and think about it. Like, okay, God, you allowed this to happen in my life. What do you want me to do with this? So the fact that my son has sickle cell disease, at the time, my job was disease state management and education, because I told you about earlier when we started talking, that's kind of what I do, is educate healthcare providers on how to manage various disease states, and doing it in a pharmacoeconomic way where you're not breaking your healthcare system budget, but also still not compromising patient health in the process. So as I started to think about it, I was like, well, why not just do the same thing for sickle cell disease? And that is how Breaking the Sickle Cell Cycle was formed. And that's exactly what I do to this day. And that was back in 2015 when I started Breaking the Sickle Cell Cycle. And in 2026, I'm still here.
Wow.
So, Dr. Scott, I do have a question. What does a typical day look like for someone living with sickle cell?
That question is variable based on where in the stage of sickle cell disease the person is in. In the early childhood ages, or I would say early childhood phases, it's something that looks like taking your prophylactic antibiotics every day. It looks like taking your pain medications. And prophylactic antibiotics, I guess I'll rewind a little bit. Kids who have sickle cell disease have a high risk of dying by the age of 5 from something that's called strep pneumo if they are not taking prophylactic penicillin. That penicillin is taken from the time that they are born up until the age of 5. If they have to have their spleen removed, then they may take penicillin a little while longer. This is important because people with sickle cell disease have a compromised immune system. So they have to have something on board that would kind of help protect them from things like strep pneumo. I would also say something that can help strengthen the immune system is making sure that they get all of their vaccinations. Because again, they don't have a strong immune system, so they need something to help them be protected. In the infancy period, if a mother is able to breastfeed, that is also something that can help confer immunity to that baby to help bolster that immune system. As the child gets older, and I would say they start to transition into the middle age range at that point, some of those same immunoprotection things are involved. But at the same time, now you may have incorporated chronic pain management, meaning that they may have some chronic pain meds that they may have to take on a day-to-day basis. In addition to that, even before they step foot out the door every day, paying attention to the weather is critical for people who have sickle cell disease. And it doesn't matter if it's hot or cold. Sickle cell disease is triggered by atmospheric pressures. And oftentimes when it rains, when it's cloudy, when it's cold, that can trigger a person who has sickle cell disease to experience pain complications. So that means this person needs to know about the weather so that they can dress in layers. Also, they need to know if it's raining outside, because if you're caught outside in the rain and you get wet and go to a cold environment, that change in temperature can also trigger a person to have pain complications that has sickle cell disease. And then, of course, when it's hot outside, you can't get overheated, because then dehydration can trigger a situation where you would have a pain crisis. So before you even step foot out of the house, you kind of have to make sure you're taking your meds, make sure that you're adequately dressed, make sure that wherever you're going, that you have an adequate source of hydration. Water is key in sickle cell disease. So making sure that you're adequately hydrated. And then we talk about, I would say, life experiences. Making sure that you are even keel and not stressed out about even the little things, because stress can also trigger a sickle cell pain crisis. So again, those are some of the common things from day to day, but it just depends on what your course of sickle cell disease looks like. And I'll say for my son now, he has a port placed in his chest because he has to go and get blood transfusions or blood exchanges every 3 weeks. So now that means that I have to flush his line every day with saline and heparin to make sure that it doesn't get clogged, like with a blood clot. I have to make sure that he takes his antibiotics so that his central line doesn't get an infection. We have to make sure that he has a dressing, and the dressing change has to happen every week. So it depends on, if you're sickle cell disease and you have dialysis, because the kidneys are one of the first organs to be compromised in sickle cell disease. So there may be some person with sickle cell that's going to dialysis a couple times a week. So as I said before, sickle cell disease is something that impacts the total body from head to toe. So that just goes to show you, it just depends on what course you have and how it's working in your life to determine what your day-to-day life will look like with sickle cell disease.
Wow.
So that's gotta have a question. So a person, especially a young person with sickle cell, are they able to live a normal life, like play sports, do those different type of things, or are they considered need to be in I call it like a bubble, sheltered?
I will say that, and the same thing that I told my son, he can do whatever he so desires when it comes down to sports. That doesn't mean that you can do it in the same way as everybody else, but it does not mean that you cannot do it. What that means in our space is that my son wanted to play basketball, and that was one of the things that the doctor was saying, like, no, he can't play basketball. It's too aerobic. He'll be too winded. It could cause him to have a crisis, and he can't go swimming because if he goes to swim, then the change in temperature can cause him to have a crisis. Well, my son knows how to swim, and he started swimming at 6 months because he was not going to be a black child that did not know how to swim.
Yeah.
That was just, something that I was an advocate for. And I also knew that in order for that to happen, there were extra things we had to do. I couldn't just take him to just any pool and say, get in. So even at the age of 6 months, I had to make sure that the pools that we were going to were heated. and that the instructors knew that he had sickle cell disease and why we had to have the water at a certain temperature. I invested in a wetsuit to try to conserve body heat. And those were the two things I think that helped out the most, so that now at the age that he is, he knows how to swim because he's been swimming his whole life. Because every summer, I would always make sure that wherever he went to go and do swim lessons, that these people are understanding of what sickle cell disease is. When he's out of the water, he cannot sit around in wet clothes. He has to change immediately, get dried off, and get dry clothes on. Because if you don't, then you will end up in a situation where you could be experiencing a sickle cell crisis, where you started out the day happy in a pool playing with your friends, and you end up in the night in the emergency room because now you're in a crisis. When it came down to playing basketball, I just made sure that his coaches knew, hey, if he feels like he is winded, like he needs to take a break, that's the time that you need to pull him out. He needs to sit down. He needs to rehydrate and re-oxygenate. That's all it is. Take a break, drink some water, and get some oxygen, and then he will be fine. So for that, I will say just making sure that if it is a young person that wants to participate in sports, just making sure that that young person is knowledgeable about what's happening in their body. They know what to do when certain things take place, and they know the importance of why hydration is so critical to managing sickle cell disease.
I have another question. I'm not trying to hog it out,
I
but
love it. I
my
love
mind
it.
be running. So, Dr. Scott, a person with sickle cell, it seems like they have to watch the temperature. So, sickle cell people, is it true to say they have to watch where they live? Because we already know the Windy City, Chicago is cold. Michigan is cold. So would you say a person with sickle cell would do better living in the southern states because it's not as cold? Or do they just have to layer and watch the temperature if they're in those type of states?
I would say both. Both, because if it's cold, because we have people with sickle cell who live in Canada, in Milwaukee, in New York. So it's not to say that you can't live in those places where it's cold. You just need to take proper precautions and layer up, making sure that you're not, I would say, caught slipping. Because the weather can, even in Nashville, the weather can change at the drop of a dime. It can be one way in the morning, but then by the time the afternoon comes, it's something totally different. So you just need to always be prepared. And in our case, for my son, we always take a jacket. I don't care if it's 100 degrees outside. He has a jacket with him because guess what? When you go into restaurants, when you go into stores, they may have the air blasting. And, the world is not going to conform to just what you need, but you have to be able to take care of yourself. And if that means you have to take a jacket with you wherever you go, then that's what you have to do to take care of yourself.
Absolutely.
And
Okay, go ahead.
And when you say living in southern states are warmer. But remember, down in the South, I would say, well, if we talk about Florida, they have a lot of rain. It may be a very humid, very muggy. The atmospheric pressure is different there. So that also can trigger a sickle cell pain episode. So you just kind of have to be knowledgeable about where you are in your surroundings, control the things that you can. And if that means making sure that you are bundled, making sure that you take some extra layering if you need to, that's what you need to do to make sure that you're okay in the space that you're in.
Okay. One more question. So when your son goes to get blood drawn, you know how we go get our annual checkup at our regular primary care doctor, is getting a sickle cell person blood getting drawn is different from a regular person getting their blood drawn?
No, it's absolutely the same. They do the same thing.
They do the same thing. I was just wondering because I know you said their hemoglobins are shaped differently, so I wasn't sure if it's going to be more painful for them to get their blood drawn. No. Okay.
So good. My question to that thing: what when you say pains, are you talking about joint pains? Or are you talking about what are the pains that are normally associated with the sickle cell disease? Is it from the joints or just total body pain? What do you say with that?
It is a lot. I would say it is joint pain. Yes. The way my son would describe it, he said it feels like somebody's stabbing you over and over and over again. I've heard some adults describe it as it feels like broken glass flowing through your veins. And I can see that because sickle cells are hard and they're rigid. Remember, they're that crescent banana shape. So that means they may have some sharp edges on them. And when those sharp edges are flowing through the blood vessel, they may be scraping the blood vessel wall. So I could see where somebody may describe that as like broken glass flowing through your veins. I've also heard it like somebody is, I'll give you the way that I first remember my son describing it. He was about 4 years old. And sickle cell disease at that point in time is very new to us. So I'm trying to understand exactly what he's going through to see how I can help him. And he was saying that it felt like somebody had a jackhammer that was beating on his legs. And he's 4. I did not know he knew what a jackhammer was. So I had to ask. I was like, what's a jackhammer? And he says, the thing that breaks up the concrete on the street. So a 4-year-old described the pain that they were experiencing to that of a jackhammer that breaks up concrete on the street. That is how I knew how painful it was.
Wow. And then when you say a traumatic situation, has it been y'all been through a traumatic situation where he had to been rushed to the hospital with this disease, anything like that? Because I'm thinking about what I had to go through, and I don't know if it was attached to my diabetes, but being rushed to for my heart attack, I don't know if that was associated with diabetes or not. But have y'all been in any type of situation where you had to rush him, or it was a traumatic situation?
Well, thankfully, we haven't had to 911 rush. No.
Praise God.
But we have had a number of circumstances where we do have to go to the emergency room. And I'm glad that you brought this up, because any child or even an adult, but especially for children who have sickle cell disease, if they were to have a fever that's greater than 100.4 or 101.4, if you're greater than 101.4, that's considered an emergency. And it's an emergency because oftentimes when people have an infection, the first sign that you have an infection is a fever. So what would normally be treated at home with like a Tylenol or an ibuprofen to help get the fever down. Remember in sickle cell disease, how I said that early childhood mortality by the age of 5, or by the age between birth and 5 years old, they can die really quickly from something that's called a bacteria called strep pneumo.
Yes.
Well, that bacteria can kill the baby within 24 hours. So that is why it is so important that if the child with sickle cell disease has a fever, it is an emergent situation, because when you get to the emergency room, they will immediately start prophylactic antibiotics just in the event that that is strep pneumo. Then you've got antibiotics already going to try to get ahead and get control of that disease state.
So, Dr. Scott, I want to, your organization, Breaking the Sickle Cell Cycle Foundation, what are some of the ways your foundation is helping individuals and families affected by the sickle cell?
Well, first and foremost, I will say for those impacted by sickle cell disease is getting people connected to resources. There are so many people in the community who may be impacted by sickle cell disease and not know where to go, whether it be resources for current treatments that may be available. A lot of people don't know about the limited number of options of things that there are for sickle cell disease. A lot of people rely on just going to the emergency room if they have a crisis. They're not fully aware of things that you can do on your own to try to help you manage so that you have crisis less often. Getting them connected with a healthcare provider that specializes in sickle cell disease if they don't already have one. And even if they do have one, is helping them to bring those conversations to the table to talk about with their provider. Whatever it is that they may feel like is not working for them or something that could be going differently, just helping to educate them with information to be advocates for themselves. And also getting them connected with other people who have sickle cell disease, other families impacted by sickle cell disease. A lot of people feel like they're suffering in silence or suffering in silos, and not knowing that there's a whole vast world of people also that are out there that have sickle cell disease that they can find unity with. So that is something that we do to try to help people who have sickle cell disease get off that island where they may feel like they are alone, and, learning more about the disease and how they can help themselves in the spaces that they're in.
Okay, Dr. Scott, I have another question. What has been one moment that reminded you that the work truly matters, which means helping these families with sickle cell? Because I know each day it's a different story. Some days I know it could be harder than others, but what motivates you?
The thing that motivates me, I will say, is young people. Well, young adults, I'll put it that way. People, when I say that are of college age, I'm going to say 18 to 24. And when I say young people, it's not to alienate people that are not in that group, but those are the people that are most likely in that childbearing age. And if I can participate in an event where we initially talk about sickle cell disease and the person may want to walk past our table and they really are like, yeah, no, not really. I hear what you're saying. It's all good, but yeah, that don't apply to me. For me to be able to talk to that person and explain to them just why this is so important, not only for their lives, but for the lives of their future children, of why they need to know what their sickle cell trait status is. To be able to change that person's mind and say, you know what, this is important. I do need to get tested. That to me is kudos for why I'm doing what I'm doing. It's important to me, yes. It's important to my family, yes. But it's also important to perfect strangers that I don't even know. All it takes is one test, and that little piece of information can change a complete generation after you. All because you are now armed with the information of what your sickle cell trait status is.
So, Dr. Scott, what would you say the biggest myth about sickle cell is?
One, it doesn't exist, because there are a number of people who will say, well, they cured sickle cell disease a long time ago.
Wow.
Well, that's not necessarily true. It does still exist. So that goes back to what I said before. If the masses can say that doesn't exist, then why would there be a need to invest in research and resources into this when it doesn't exist? So that is the biggest myth that I will say that's out there, is that sickle cell disease is gone. It doesn't exist. The other one that I'll say I think is really big, I think it's a tie. People with sickle cell disease are lazy, and people with sickle cell disease are drug seekers. I hate that with a passion, because people with sickle cell disease are not lazy. When you see a person who has cancer and they've gone through chemo and they're just wiped out and they can't make it, you don't walk up to that person and say, oh, you're just lazy. You would never say that. And with sickle cell disease, they get labeled as being lazy. So when you think about what your red blood cells do, your red blood cells are responsible for carrying oxygen throughout your body. And when you don't have enough of those red blood cells, you are what's called anemic. When you are anemic, you are tired, you are fatigued, you are sluggish. You are not lazy. You are suffering because your body does not have enough red blood cells produced to do what it needs to do. That is what people with sickle cell disease face 365 days, 24 hours a day. It's called sickle cell anemia for a reason. You have a deficient number of red blood cells, which is going to cause you to feel sleepy, to feel tired, to feel sluggish, to feel like you just don't have it within you to go. So that's a myth that I really wish that people would not associate with people who have sickle cell disease, is calling them lazy, because they're not lazy. They're just dealing with the cards that they were dealt.
Right.
Not only is that a myth for people that have the disease, but it's also something that people who are dealing with those symptoms need to go and get checked if you're dealing with those diseases. Because you said a whole lot of things that a lot of people that I come in contact talk about, with tiredness, with fatigue, with mental fog, with a lot of different things that could be associated with this and not even know. So that question was loaded with a lot of different things. So within the next 10 years, because like I said, Donald, this goes by fast, but within the next 10 years of the foundation and what you're doing with everything that's going on in your life, what is some of the things that you want to see happen for sickle cell research or for anything going with the foundation in the next 10 years, Lametra?
I will say within the next 10 years, I would love for people to really not have sickle cell disease. And when I say that, I am speaking on the realm of where we are with gene therapy and sickle cell disease. In 2023, the FDA approved 2 gene therapies that are transformative treatments for sickle cell disease. Prior to gene therapy being on board, the bone marrow transplant was a curative option for sickle cell disease. But in order to go through a bone marrow transplant, you actually have to have a genetically matched donor in order to be cured of sickle cell disease. A lot of people who are African Americans do not have a matched donor. If you don't have a matched donor, then that means you have to depend on a registry, or and in that registry, just like there's a shortage of African Americans or minority people who donate blood, there's even more of a shortage of minority populations who donate marrow. So trying to find a match is like trying to find a needle in a haystack if you don't already have one. So that meant that the curative option by way of a bone marrow transplant may have been very, very limited for a lot of people with sickle cell disease. They just had to suffer with it. Well, in 2023, the FDA approved 2 gene therapies where now you no longer have to have a genetically matched donor. They can actually take your cells, genetically modify them so that they no longer produce hemoglobin S anymore. They make normal hemoglobin with one of the procedures. And the other procedure is that switch that I talked about early on about hemoglobin F being made during the fetal period, turning off, and then the body turning that regular S switch back on. Well, the other treatment option turns that fetal hemoglobin switch back on. And that's important because fetal hemoglobin is different from normal hemoglobin in that it does not contain the same subunits. So therefore, it does not sickle. So that is huge. In the next 10 years, I would love for sickle cell gene therapy to be made available to anybody who wanted it. Just like you can go to the doctor and for your diabetes, there's a multitude of options that you can pick for how to manage your diabetes. I would love for there to be a multitude of options for people with sickle cell disease that they can select on what will work best for them in trying to cure them of their sickle cell disease.
So that's kind of a quick question. So I know you said that the sickle cell is in the shape of a crescent, right? So basically there's not a cure for sickle cell. So most of the time you get medications just to help with the pain, correct?
Well, there is now. Prior to 2023, there was a medicine called hydroxyurea. It's kind of like the gold standard. And what hydroxyurea does is that it causes the body to produce more hemoglobin F. That fetal hemoglobin that we've been talking about that does not sickle is made during the fetal period. The only issue is that hydroxyurea doesn't work for all types of sickle cell disease because there are several different types of sickle cell. There's not just one. And hydroxyurea has not shown to be as much of a benefit in other forms of sickle cell disease as it has been for sickle cell type SS. Although if a person were experiencing pain episodes, pain crisis, hydroxyurea is definitely something worthwhile talking about if you have sickle cell type SC or if you've got sickle beta thal, something to that degree. It may be helpful. That's just a conversation that you'd have to have with your hematologist. So prior to hydroxyurea being on board, and the bone marrow transplant, which is a cure because that means you've gotten a marrow from a donor. And your body, basically what happens is you undergo chemo, wipe out your bone marrow, the new donated marrow is transfused into your body, and then your body begins to produce more of that donated marrow, and you don't have sickle cell disease anymore.
Oh, wow.
So now that same process where you get cells transfused in that have been genetically modified can now take place because we have gene therapy. And that's the space that I'm in with my son today. We are actually going through the gene therapy process right now. It's a long process. It takes about, I would say, 6 months from the time the cells are harvested. So in his process, I say we like I did it, but he underwent a process that's called cell harvesting, where they collected his cells. Those cells were sent off to the manufacturer to undergo genetic editing, and it goes in and it cuts out the part of the DNA that encodes for making hemoglobin F, turning that switch back on. So now when his cells come back, he will undergo chemo for a little bit. They will transfuse those genetically modified cells back into his body. And now that his cells have that switch turned back on, they will only produce these hemoglobin F cells. So it increases the amount of hemoglobin F that he has.
So basically, you're saying the blood that's going to be produced into his body is going to actually go in and create more of the blood cells needed to heal and get him totally free from this disease. That is amazing.
Yes, that is amazing.
Yeah, that is nothing but the grace and glory of God. I'm telling you.
Come on, Lametra. That to hear that right there, to know that there is a cure that is on the way, that is happening. And I was gonna ask the question, what would you say to someone who was dealing with sickle cell? And you just hit it on the head, that we have research that is going on that will allow someone to be healed from the disease. Now, I'm finna go here. Why is that not for all diseases? Why are we not? Or are we working on things that help for all diseases?
Somebody somewhere is, I'm sure. I can't speak for everything, but I can say that research and development is critical. And with the administration that we have right now and cutting funding to certain research programs, it's definitely going to stall the R&D process that manufacturers are able to pursue. It won't cut it out completely because technology is forever moving forward.
Yes.
But I will say that dollars are continually needed to be invested into research and development for all conditions. In sickle cell disease, thank God, just so happened to be one of those that was pushed to the forefront over the past, I would say, 10 to 15 years, where money has actually been devoted into R&D and trying to find a cure for sickle cell disease.
Absolutely. Lametra, amazing night. Time always goes by super fast when you're having a great conversation. I really want to give something in within 1 minute. You only really got 1 minute to answer this because I don't want it to be long, but being that you are a pharmacist, and I told you about one of the medications that I'm on, and a lot of people that I know are their own medicine that's like this. I'm on Ozempic, so I can put that out there because that's what I take for my diabetic situation. So with taking that, I've noticed that I have lost a lot of weight. Okay, one thing that you did tell me is that anyone that is on this medication, they need to make sure they're eating properly and working out. So just before we get off this call, because I know it's a lot of people that's going to take this medication, can you just give real quickly something for just to help people that's taking that medication, to let them understand the importance of the working out and eating and understanding what this does to your body? Come on.
Yes, I will tell you that losing weight is great, but you also need to make sure that you are eating the proper amount of protein, because protein is necessary for building muscle. With you losing weight and not eating, or you're not as hungry anymore, because that's what the medication is going to do, your body still needs energy for fuel. So if you're not eating it, then guess where it's going to get it from? It's going to get it from itself. So basically, you'll start burning up and eating up your own supplies, and you will start to be saggy. You'll be skinny, but your skin will start to sag. So therefore, you want to make sure you're eating your protein and that you're doing some type of weight-bearing exercise 2 to 3 times a week to help build up that muscle that you would otherwise be losing if you're not eating protein and you're not working out.
Amazing. I'm gonna have to have you back for another conversation about some of these things, but it has been an amazing night, y'all. Thank you so much, Lametra, Dr. Lametra Scott, for just enlarging our territory and letting us know a little bit more about the sickle cell disease. Your foundation is so amazing. Can you say your foundation one more time? Give us the correct name before you get off the air with us so we know we got it locked in. Can you get that to us real quick?
Sure. It's Breaking the Sickle Cell Cycle Foundation. And sickle is spelled with 2 S's. That's how you will be able to, if you just Google it and you type in sickle with 2 S's, it'll be the first thing to pop up.
Absolutely. Monica, you want to take us out tonight real quick?
Well, I wanted to say thank you once again, Dr. Scott. You've been listening to Tab Nashville Gospel Radio 104.1 FM. Tab Nashville Gospel Radio and the Encyclopedia Conversations. Just remember to subscribe, and we'll pray that you all have a blessed afternoon.
Y'all be blessed out there.